Welcome to Medicare Lagniappe, where we cut the confusion on all your Medicare-related questions and cover topics plus real-life scenarios to empower you for a better understanding of your Medicare options today. Welcome to Medicare Lagniappe, Fussell Group's premier site of learning everything about Medicare. My name is Caroline Badon, and today I'm here with Dr. Catherine Fussell, doctor of one of our local physician's offices around here in Louisiana. So we will be discussing all of the things that's important to know for Medicare recipients in their health and things like that. So thank you so much for being here.
Thank you for having me today, Caroline.
So tell us a little bit, let's just get started kind of with the basics. What is a Medicare wellness exam? So what do they do?
So the goal of a Medicare wellness is really to talk about preventative health and making sure the patient is on the right track to keep them healthy. So I think it's a common misconception that a Medicare wellness is to have kind of a whole physical exam or that it's to talk about your chronic conditions. Of course, we touch on chronic conditions, but really we're talking about preventative screenings like mammograms and pap smears if that's still relevant. Other things like abdominal aortic aneurysms, lung cancer screenings, colon cancer, all of that. Additionally, one of the really important things that we talk about when it comes to Medicare wellness is how is the patient doing with their, daily tests? Are they still doing okay with all of their ADLs, getting around? Are they still driving? Are they, able to manage their own finances? Are they getting to a point where they need assistance in different areas? And is that something that we can help with?
Okay.
Additionally, another thing that we talk about is advanced care planning. So that's something that's really important. Really for everyone, but especially for patients as they begin to age and get closer to potentially needing some help in that arena.
Yeah, so I know a few of my clients have said before, I don't need to go to my wellness visit, I'm healthy, I'm good. But it is important.
Absolutely. So in addition to those things, we also look at all medications. So, as the primary care physician, sometimes a patient that has several conditions, they might be seeing a cardiologist and a gastroenterologist and, numerous other specialists. And so it allows us to kind of say, okay, well, what's changed since your last visit? What medications are you on? Are there any new ones? And us to kind of be a little bit of the quarterback to look at and say, maybe we need to kind of switch this up, or you're doing two of the same things, potentially, medication interactions. As much as, we've grown in the world of having electronic medical records, there still are sometimes, deficiencies in our communication skills that we can kind of help to overcome.
So what is the main difference between an annual wellness visit and their Medicare exam?
So the annual wellness visit actually doesn't even include like a physical exam. The wellness visit is really just kind of pertaining to all those things. A regular exam or checkup is more either for a chronic condition, just to kind of like say, okay, you're doing great on your blood pressure medication, or you do for labs, all of those things, or for an acute visit, like they have a new issue or, respiratory infection, UTI.
Okay.
Something along those lines.
So tell me a little bit, no one likes getting blood work done. How important is it for these people to get their lab work done?
So I think it's very important, not only in terms of just, making sure that we're staying ahead of the game to pick up anything that could be starting to come about in terms of chronic disease, but when you're on medications, especially on multiple medications, some of those meds really can affect function of the body. So for example, there are several medications that we know deplete B12. Metformin is a good medication. It's been around for a long time. We use it for insulin resistance and diabetes control. And so there are a lot of patients, especially that are of age of Medicare, that end up on this medication, but it can affect the kidneys over time. It can affect the B12 levels. And so that's just an example of why we need to look at that.
Okay. Yeah, so just to make sure all of the levels, even, especially if you're on a bunch of different medications, are
Correct.
okay.
Correct.
Because maybe fixing one problem is causing another.
Potentially, yes.
Yeah. Okay, so how important is it, other than seeing the doctor for your annual wellness visit, or if you're sick, how many times do you suggest a patient come in for a checkup a year?
I like to see all my patients at least 2 times a year because sometimes I think they might not even realize that there are things that are changing. For example, if they've had, a weight loss of 10 pounds, we want to know why. Was that intentional? Is it because you had a change in your diet or lifestyle, or is there something else going on that maybe we need to look into a little bit more?
Right.
Same goes for, other vital signs, or even I may notice they're having a little swelling in their legs. Do we need to change something up? Is there either a medication that's causing that or a lifestyle change?
Well, it's kind of like you go to the dentist Twice a year.
Correct.
So
So
you
it's
need to
kind
see
of
your
like for a maintenance.
physician. Yeah. Okay. So a little bit, we have some more things here that we want to go over. Why does a senior need an advanced directive?
So advanced directives are tricky because basically what it is it's kind of setting a plan for who's going to help to make decisions and what those decisions might be if you're in kind of an end of life situation or an acute situation medically that you need someone to decide on your behalf. So when we talk about those things, ultimately mortality comes up and nobody loves to talk about that.
Right.
But I personally think it's really important because I've seen situations happen where the conversations weren't had in advance, and they'll say, I don't know what mom would have wanted. And that's kind of a sad place to be, because especially if you have opinions about your care and what you do and don't want,
Right.
it's important to express them so that the people that you love know and can make those decisions for you.
So going back to more of like the health related topics that we were talking about, I know there are certain medications that you can't just cold turkey stop taking. So why is that important? And then if there is a medication due to like the prescription drug plans and things like that maybe aren't covered on a formulary on the plan that they choose or something like that, and they can't afford it out of pocket, how can you help?
Yeah, so, depending on the medication, some things are okay to stop, but medications that we use, for example, for anxiety, there are some that you can't stop, you have to wean. You can have risk of seizures or other withdrawal symptoms. As far as cost goes, I would say there's always an option. Whether it's that we can, communicate with the actual company that makes the drug to see if they have any programs. You'd be surprised, I think, to know that a lot of the pharmaceutical companies do. They have other options that can at least help to assist us and alleviate some of the cost. Outside of that, there's programs like GoodRx where you can, get cheaper cash pay prices to kind of shop the pharmacies. There are either some pharmacies I know locally that just honor that they're going to beat those prices if they can, to really help the patients out. And then you also can just explore what other options we have as far as medication substitution. So I always tell the patients, if you have an issue, just let us know. We can look at kind of big picture and see, maybe there's 2 medications instead of a combo medication that are cheaper that we can do. Sometimes we may prescribe it because we think it's a little bit superior, but there's still a good option.
Right.
So
There's
I'd
always
much
another
rather than
route you can take.
Absolutely.
Okay, so tell us, as a doctor, what are some things that you would suggest to a Medicare recipient, say it was your parents, to stay healthy, to stay active? Are there certain vitamins that are super important for that age group? Obviously, we know water, things like that. But what do you think?
So I think the number 2 things, which I think we already all know, are going to be movement and diet. So, staying active, staying physically active is incredibly important. We know and have known for a long time that a sedentary lifestyle is not good for health. And I think, sometimes when we retire, especially, we become a little bit less active because you're not forced to do that.
Relax.
Exactly. But, on that note, a lot of the Medicare programs actually support like gym memberships, or you get discounted memberships and things like that. So I often encourage my patients to look into those options and see what they have out there. Even some of the physical therapy places offer, memberships to their gyms or whatnot for our Medicare patients. And so there's lots of options to stay moving. But it's not only important for your physical health, but your mental health, in terms of mood, but also memory, and keeping you sharp and whatnot. And then diet is, of course, a big thing. I always kind of encourage patients. It can be really overwhelming to think about, well, what are you not supposed to eat? What are you, not supposed to do? But I think if we focus on just getting whole nutritious foods, lean protein, fruits and vegetables, then that's more than half the battle.
Yeah, I agree with you. So staying healthy is huge. And then visiting your doctor twice a year. I mean, those are the things to kind of stay on top of what they need to stay on top of.
Absolutely.
Well, thank you so much for joining us.
Thank you for having me.
That's all for today. Catherine, thank you for joining us. If you've enjoyed this video, like and subscribe and stay on the lookout for more. If you are looking for a primary care doctor, you can visit Catherine and her team at Fussell Health. Follow us on Facebook, Instagram, and visit our website at fgiala.com. Thanks for watching. This has been a Fussell Group Insurance Advisors educational production series. If you enjoyed this video, like and subscribe and stay on the lookout for more. Please follow us on Facebook, Instagram, and visit our website, fgiala.com.